I recently read a quote that resonated deep in my bones. The quote stated that most women don't know that they are in perimenopause until they are really in it. This feels so very true for me right now. Last year in 2023, I found myself going down so many rabbit holes trying to figure out why I felt so depleted, irritated, brain fogged, and overall, I just felt like a worn down version of myself. It was such a profound shift that I was desperate for answers, especially because I had felt so good. I'm talking resilient, strong, lean for over a year once I got through the intense postpartum years. What I realized at the end of 2023, December 2023 to be exact, was after multiple blood lab draws, going back on an autoimmune protocol, testing for gut issues with the GI map, and testing for stealth infections, including mold and parasites, that I was smack dab in perimenopause. And I believe that so many women are in my shoes, approximately 24 million or so here in the US. Whether they are recovering from postpartum in their 40s, which can feel like menopause due to very low estradiol and progesterone levels, or they have polycystic ovarian syndrome or low thyroid function, or maybe an autoimmune condition that's driving that, or an unhealthy gut and or sluggish liver, or maybe even struggling with insulin resistance and inflammation. And then adding insult to injury, their critical reproductive hormones, progesterone and estradiol, start to rapidly fluctuate and decline. And as a result, it can feel so confusing because it is hard to determine whether their symptoms are coming from another type of chronic condition or they're coming from perimenopause or a combination of the two. And I think for many of us, it's a yes and. It's not until you're able to rule out the other potential health issues and start to add up the perimenopausal symptoms and the menstrual cycle changes that you finally realize that you are in it. I mean, really in it. I also want to highlight the massive knowledge gap surrounding perimenopause in the healthcare system. It's no wonder that many of us are left in the dark when we go to our doctor and they don't have any answers for us, and that is not okay. For example, I had gone to my primary doctor multiple times last year to get labs approved. I'm talking inflammatory labs, metabolic labs, blood sugar labs, CBC, the complete blood panel, all of it. Because I was really looking for what was going on with me. It wasn't my thyroid. Was it my thyroid antibodies? Like, what was happening? I can't tell you that my C-reactive protein had jumped. So I was concerned about an inflammatory issue in my body. But there was a point in December, I want to say mid-December, after we were sick, which honestly, we were sick so much in the fall due to having a toddler in preschool and traveling and doing all the things. But I remember distinctly in mid-December, it felt like the level of fatigue that I was dealing with was at a 10. It felt like someone just sat on my chest. I was so exhausted. And it was as intense as when I had my brain injury over the summer. And so I wanted to see what was going on. And I asked for a specific type of test that were looking at inflammatory markers like homocysteine, sed rate, again, C-reactive protein. I wanted thyroid labs. I wanted a ferritin and iron panel. What was going on that had me feeling so exhausted. And I remember when I came in and kind of explained what was going on with me and why I wanted these labs, she just looked exacerbated. And she said to me, she's like, man, you've been really trying to figure this out all year, haven't you? And I was like, yeah, I have. No thanks to you. And I mean, I know that she only can meet me where she can meet me. I get it. But it was just such a, it was just not the response I was expecting. And she really it felt like she was putting the blame on me, that it was my fault that I felt this way. And here I was just trying to clue in to any answer. Now, I will say that luckily, whatever that was in December subsided. I don't know what it was. I don't know if it was a reactivation of something. I just don't know. And I feel so much better in 2024 than I did in most of 2023. And I'm really holding the vision that it continues this way. And so I just wanted to share that little story because that rarely happens, because I have a lot of practitioners that are functional doctors that are really good friends of mine that are willing to really dig into the root cause. But, when we go to our primary doctor, it's often just not within their scope, and they don't know how to look at the information and assess the labs. Oftentimes, doctors won't even run specific labs for you because they don't want the responsibility of having to interpret those labs and make recommendations based on those labs. And so thank goodness there's a lot of other, places that we can go to run labs today, including like Inside Tracker or even Levels Health, where we can look at some of these labs and get a better sense of what's going on with us. Okay, now before I get into how to know if you're in perimenopause and the multitude of symptoms that occur or can occur in perimenopause, I first want to share some numbers with you to give you some context. As I've shared, perimenopause is one of the most underdiscussed inevitable changes, and it affects almost every woman at one stage or another. And I'll share the exceptions in just a moment. And while, like puberty, the experience can vary from person to person, it is usually characterized by a range of symptoms and obviously menstrual cycle changes, which typically begin between the ages of 39 and 44 years old. Now, given this time frame, most women born in 1984, 1985 are most likely in early perimenopause. Now, I was born in 1979, and I really started experiencing symptoms last year at age 43 due to finally coming out of postpartum and ending my breastfeeding journey. Actually, my symptoms began about 2 to 3 months before I was ending my breastfeeding journey, but I really wasn't making a lot of breast milk at that point because Kingston was basically 2.5 years old. So I think my body was like, girl, you're done. Let's move into perimenopause. And I will say that I got pregnant at 40 and a half years old. And I remember late 38, 39, even 40, I was, managing my Hashimoto's thyroiditis. I was, just taking care of a lot of other health concerns, cleaning up my gut, cleaning up my liver. And so I could have had some early perimenopausal symptoms then. Definitely my progesterone levels were extremely low to the point that I was on a micronized progesterone in 39, 40 to ensure that I got pregnant. And I'm also on that micronized oral progesterone today to help manage my symptoms of perimenopause. So again, it really depends. Like they could start as early as your mid 30s or as late as your mid to late 40s, really depending on the person. So for some women, perimenopause can begin much earlier or later. Symptoms can also vary in severity. For some women, symptoms can be a minor inconvenience. For others, they can be life-altering. And I find myself in the life-altering category. And that experience can feel deeply upsetting, depending on what the symptoms are. Now, although it's common to refer to these symptoms as menopause symptoms, it's actually the transition phase called perimenopause that causes the majority of symptoms due to the default hormonal dysfunction or default hormonal chaos that's happening due to fluctuating and declining hormones. Most importantly, perimenopause has been considered a systemic inflammatory transition that enables later neurodegenerative disease, genital urinary dysfunction, and cardiometabolic disease. I cannot emphasize how profound this transition is. The perimenopause transition has serious impacts on every aspect of a woman's physiology, and this is true whether or not symptoms are present. So I just want to repeat that really quickly. The perimenopausal transition has serious impacts on every organ system of the body. And this is true whether or not you have symptoms. In short, perimenopause is going nowhere necessarily good. And what I mean by that is that there is nothing about complete hormonal disruption and precipitous hormonal decline due to the exhaustion of ovarian germ cell supply that make women healthier. Ultimately, the decline of these critical hormones puts us at greater risk. Now, this transition has serious impacts of every aspect of a woman's physiology, as I mentioned before. And this is even women who make it to menopause without a hot flash or brain fog. They are still going to experience physiological changes that will impact their metabolism, their neurological health, and their cardiovascular health. So the reason why I'm saying this is because I know so many women get into menopause or post-menopause and they don't really have a lot of symptoms. And they think that they are in the clear. But what's important to note that whether they had disruptive symptoms or not, that their body has shifted and changed. Their brain is different. Their metabolic health is different. Their body composition is different. Their muscle is different. All of it has changed. And because our bodies are changing without permission, we really are in a position to make changes at the same exact time. So I consider this mission critical. And depending on how we take care of our bodies during the perimenopause transition can really determine how our bodies thrive in postmenopause. Okay, now I want to quickly share some numbers with you before I dive into helping you figure out if you are in perimenopause. So perimenopause is the 4 to 10 year transition where the ovaries are declining in function, and as a result, you experience default hormonal disruption and precipitous hormonal decline. Now, until you arrive at menopause, which is the one point in time 12 months after a woman's last period, and some say it's literally one day. Like menopause is one day. It's the day that you haven't had a period for 12 months. And the average age for menopause is 51 years old. And then after that, you are then in postmenopause. So menopause or postmenopause, basically that is after you get through the transition stage where hormones basically drop to that menopausal level, and you basically stay at that level unless you're supplementing with hormone replacement. The natural menopause happens between the age of 45 and 55, with the average age of 51 years old, as I mentioned just a second ago. Early onset menopause happens before the age of 45. Premature menopause and ovarian insufficiency happens before the age of 40. And women, because perimenopause can start 4 to 10 plus years before menopause, and let's say early menopause can happen at 45 years old, you can literally be in perimenopause as early as your mid 30s. And for some women, maybe even a little bit earlier than that. Now, the amount of women that are in menopause right now are 50 million in the US, and 24 million women are in perimenopause in the US. And there's going to be 1 billion women in menopause, the most women in menopause ever in the next couple of years. Now, how many women experience symptoms? 100%. You're going to experience something. Your body is profoundly shifting. You are going to be a different person. And then how many women in menopause are on hormone replacement? About 4%. And that's really due to the results that have been redacted, majority of them have been redacted in the Women's Health Initiative, which is another conversation for another day. All right, so how do you know you're in perimenopause? It's really all about symptoms and menstrual cycle changes because there is no absolute test to know you are in perimenopause. It's usually characterized by a range of symptoms, again, which typically begin between the ages of 39 and 44, but can be sooner or later, depending on your situation and depending on when your menopause date has been set. And that really has been set when you were a fetus, like depending on how many eggs you have, your ovarian germ cell, basically your egg supply kind of really dictates that. So maybe you have been, you've been selected to go into menopause unless something else comes up where you have to go into early menopause, at 52 years old. And then, so your body kind of reverse engineers all of that. At the end of the day, perimenopause is a natural transitional phase of life. That's why I like to call it the second puberty. And just like we don't test 14-year-old girls who have a period and are growing to know that they are in puberty, we don't necessarily need to test to know a woman is in her mid-40s and in perimenopause. Not that testing isn't helpful, especially when ruling out other health issues and knowing your numbers to determine your overall health. Now, there is no escaping this long transition unless you undergo induced menopause, either surgical or chemical, aka medications like chemotherapy. And then there's other medications as well that can induce a chemical menopause. Or you are experiencing primary ovarian insufficiency. Now, a quick note about primary ovarian insufficiency. This is a condition in which younger women, sometimes as young as their teens, skip many periods in a row or have no periods at all. A blood test may report signs of menopause and or very few eggs left in the ovaries. Ovulation may still occur every once in a while, so pregnancy is possible even though it appears as though a woman is in menopause. So again, hopefully, if this is the case for you, you have tested for this and you've had an appropriate diagnosis. So real back to perimenopause. So the perimenopause transition takes place in two phases known as the early phase and the late phase. The early phase is defined as occasional skip cycles along with issues like burnout, exhaustion, mood swings, brain fog, even a sluggish metabolism. That second phase is characterized by greater menstrual irregularity with periods of amenorrhea, which is no menstruation. Basically, you're just skipping ovulation. So anovulatory cycles, lasting for over 60 days and up to 12 months. And accompanied by a slew of symptoms: night sweats, hot flashes, heavy periods, migraines, mood changes, difficulty in sleeping, and so many of the symptoms that I'm going to cover in just a minute. And right now, I am technically in the early phase, and I am also experiencing a wide array of symptoms, but I'm still cycling regular with a couple missed ovulation cycles, and my cycle averages 26 to 28 days depending on the month. Now, because menstrual cycle changes are a big part of what defines perimenopause, I do highly recommend tracking your cycle, especially if you are not on hormonal birth control. Tracking and understanding your cycle changes can inform you if you are ovulating, especially you really do need to track with basal temperature in the morning, because again, when you ovulate, your basal temperature will jump a half a degree. And that's because of that release of progesterone from the corpus luteum. So that's how we know we're ovulating. I mean, obviously you can get ovulation strips if you want to know as well, but the best way to really track your cycle is looking at your basal temperature every single day and then logging that as well into a period app or a menstrual cycle app. Now, if you are making progesterone, and you can really kind of help gauge those PMS symptoms or other symptoms that you can track through your cycle. So my recommendation is, one, track your menstrual cycle and track your symptoms along with your menstrual cycle. For example, on day 21 of my cycle, I noticed like clockwork that my hormones choose violence. I'm extremely irritable, tired, and frustrated. So I know that if I feel a bit under-resourced on the 20th of my cycle, the 20th day, that most likely on the 21st day, I'm going to feel like a raging dragon. So I let my husband know immediately, and I rearranged my schedule for more alone time, and I added more self-care to help regulate my mood and body during the 5 days leading up to my period. I also notice on some months that I don't ovulate, and as a result, I don't make I just don't make a lot of progesterone or really any progesterone, that I'm more anxious and I have a harder time getting to sleep and I feel more triggered and deregulated. Hence why I'm taking oral micronized progesterone called Prometrium during the second half of my cycle, that luteal phase, to help curtail some of this. So my progesterone levels have been low for a long time. Obviously, they're getting even lower. And at this point, cycling oral micronized progesterone makes the most sense for me to just kind of, ease out some of those symptoms in the second phase of my cycle, at least right now. I'm also looking into an estradiol patch pretty soon because I'm noticing that some of my symptoms are related more towards estradiol depletion and kind of just crazy fluctuating estradiol levels. And I want to kind of nip some of those in the bud. One of those symptoms for me is migraines. I have been having horrible migraines since I was pregnant. So for about 4 years now, and I am so ready to get them under control. Now, if you are on hormonal birth control, it's important to note that you are suppressing ovulation. And I'm not going to lie, ovulation, while she's still available, is a superpower. Even in perimenopause. I know it doesn't feel like it, but it can be a superpower. And it's really the synthesis of your reproductive hormones. So hormonal birth control can be a double-edged sword. And I have an entire podcast devoted to this topic titled, Are Birth Control Pills the Best Remedy for Perimenopausal Symptoms? It's episode 398, and it's linked in the show notes for you to go and listen to this episode. So I go way deep down the rabbit hole on that episode. On one side, progestins, which are synthetic progesterone, and synthetic estrogens like ethinyl estradiol can significantly help to suppress perimenopausal symptoms because there isn't wildly fluctuating hormones during a time of complete hormonal dysfunction and disruption. That is true. They also come with side effects for many women due to how the synthetic hormones are made and how they bind to receptor sites. Progestins, for instance, are often made from testosterone and have been known to bind to other receptor sites that drive more inflammation and more side effects. So there's that. On the other hand, women shouldn't suffer from symptoms of complete hormonal disruption, in that 7 to 10 year transition period, right? No, we should not. The answer is no. So that's where the conversation around bioidentical hormone supplementation comes into play. A big argument is being made that bioidentical hormone replacement therapy are beneficial during perimenopause for a number of reasons, including they are identical to your body. It's what your body makes. I mean, they are synthesized, but the compound is identical to what your body makes, and it can bind to those specific receptor sites. And when you start hormone replacement therapy earlier, before menopause, it can reduce your risk of cardiovascular disease, muscle loss, bone loss, neurodegenerative disease, and genital urinary dysfunction, along with reducing many symptoms that I am about to list off. Now, there is a lot of debate on the topic of hormonal birth control versus bioidentical hormone replacement therapy supplementation in perimenopause. Now, if you're wondering where I land on the side of bioidentical hormone replacement therapy. And there are a lot of FDA-approved options, including the oral micronized progesterone, which I believe I get for like $12 a month. And there's estradiol patches. So just note that there are options that are FDA approved that you can get. They don't have to be compounded. And there are definitely cases for women to have them compounded, particularly if there's an allergen in the FDA approved over-the-counter or in the pharmacy type of hormone replacement, then a compounding option is a better option for women. So just note that, there's a lot of nuance here as well. And this is not the episode for that. But I just wanted to share that I land on the side of bioidentical hormone replacement therapy to top off hormones in perimenopause for most women, especially if you're dealing with symptoms that are so disruptive that are rocking your world. If hormones are the first line of defense to manage those symptoms, then giddy up, let's get on them. But I also know that some women simply do better at reducing disruptive symptoms when they're on progestins versus bioidentical hormone replacement like oral micronized progesterone, which is called Prometrium. So yes, there are some women who start the oral micronized progesterone and they may have side effects to that, or their symptoms don't subside, and then their doctor puts them on a progestin IUD and they feel so much better. And if at the end of the day, the goal is to reduce symptoms, and the progestin worked better than the oral micronized progesterone, especially during perimenopause, then I say do what works best for you. You got to do what is individualized to what works for your body. When it comes to hormone replacement therapy, at the end of the day, it needs to be tailored to the individual based on their symptoms and how they tolerate the addition of hormones along with lifestyle modifications to set them up for success. Another part of this, which is super critical, is that your gut and liver need to be able to properly metabolize these. And so although hormones are optimizers and powerful at reducing symptoms, if your gut and your liver are not effectively doing their job, you may not feel as much benefit. So again, there's a lot and if you have massive insulin resistance and crazy metabolic issues, your hormones aren't going to fix that. And you may find that hormones, kind of don't touch a lot of the symptoms that you're dealing with. But so often they are really powerful optimizers, hence why I'm looking to get on, I'm already on one and I'm looking to get on the other one. Now, because this transition is so critical, you really need a comprehensive program or protocol that addresses the crazy hormone changes, the metabolic changes, the brain changes, mood changes, and the slew of symptoms. In perimenopause, hands down, your body is changing without permission. Whether you have symptoms or not, it's imperative that you pivot to optimize your health, strength, and resilience. It's in this window that we have the most influence, so we have to take advantage of it. Once we are in menopause, some of the profound changes are locked and loaded because estradiol and progesterone are basically non-existent. They're at menopausal levels. And let me tell you, it's pretty much zero. I'm just going to tell it to you straight. I know we've been told that adipose tissue and our adrenals make a little bit, but they don't make much. Hence why hormone replacement therapy is very much the conversation to be having again, because so many women do better in terms of increased longevity around their cardiometabolic health when they're on them. Now, because I've read the research and scoured through dozens and dozens of articles that exist on metabolic, immunological, neurological, and mitochondrial changes that occur in perimenopause, I am taking some massive steps to help optimize my metabolic health, because that's really where we want to focus our efforts. And I know that over 24 million women are on this journey in the US right now with me. Because of that, I am hosting a live class on March 12th, that's literally next Tuesday, on the truth about midlife weight gain and metabolism. And I will have the link in the show notes here to register. It is totally free to register. It's going to be super high value. I'm going to share with you in a second what I'm going to give you in the actual class. But you can register again at drmariza.com/midlife. And again, it's in the show notes. So what you will gain from attending this class, which will be about an hour long, give or take. I'm going to go over the science behind the profound changes that happen in a woman's body during perimenopause and menopause. I'm going to highlight some of the biggest areas. The most up-to-date lab testing for women in midlife, overt and subtle symptoms of metabolic issues, and the biggest levers women can adopt to build strength, resilience, and increase their health span. And a process to work more closely with me to create a tailored plan along with community accountability and real-time support. Given the extensive shifts in my body over the past year or so, I feel beyond driven to continue to dive deeper into the latest research and share the findings we are discovering about women in perimenopause. The system-wide changes in our bodies are far more reaching than previously understood, and are at the very least really validate so much of what women have been struggling with for centuries during the menopausal transition. Right? So often we were just told we were crazy, or that, oh, we're just getting old, or whatever it may be, or this is just our lot in life. And there's so much more to it than that. The level of gaslighting is it's mind blowing. It's mind blowing. Now, because our estradiol and progesterone hormones have receptor sites on every organ system in the body, most importantly, the brain, perimenopause is not just a result of declining ovaries. It's the result of extensive brain alterations, immune system alterations, and metabolic and muscle alterations, leading towards a more inflamed state. We want to know why we see an uptick in autoimmune conditions, Alzheimer's, heart disease. I mean, my gosh, diabetes. The list is so extensive. Right after perimenopause or in the middle of perimenopause. And the symptoms are at the epicenter of these massive changes, right? If your brain is changing, your immune system is changing, your metabolism is changing, your body composition is changing, your microbiome is changing because of the fluctuating hormones, do you think that you're going to have symptoms in every system of the body when the biggest kind of what I call the biggest operators in your body are shifting, at a profound rate? Yes. So for example, over 66% of women will experience mental health and brain-related symptoms in perimenopause due to the changes in their brain. Lastly, before I jump into the symptoms list, I want to share with you an abstract from a research article in the Journal of Neuroinflammation, which is titled "The Perimenopause in a Woman's Life: a systemic inflammatory phase that enables later neurodegenerative disease. Now, I will have the link to this article in the show notes to check out, but here is the abstract. The perimenopause or menopause transition, the time period that surrounds the final years of a woman's reproductive life, is associated with profound reproductive and hormone changes in a woman's body and is exponentially increasing a woman's risk of cerebral ischemia, so stroke, and Alzheimer's disease. Although our understanding of the exact timeline or definition of perimenopause is limited, it is clear that there are two stages of perimenopause. There is the early menopausal transition, where menstrual cycles are mostly regular with relatively few interruptions, and the late transition, where ovulation becomes non-existent or it's skipped and lasts for at least 60 days up to a final menstrual period. Emerging evidence is showing that perimenopause is pro-inflammatory and disrupts estrogen-regulated neurological systems. So the premise of this article states that due to fluctuating and declining estradiol levels in perimenopause, not even to mention progesterone levels, which some of it is made in the brain and it's super neuroprotective. I was on 200 milligrams of permetrium during my brain injury protocol to reduce the amount of brain inflammation that I could have potentially been accumulating. So progesterone is used very often in post-concussion syndrome and just kind of reducing inflammation. So just know that this was just looking at estradiol and not even progesterone. So fluctuating and declining estradiol levels in perimenopause, the body and brain experience a pro-inflammatory state, and that these changes can enable later neurodegenerative disease. In the upcoming book by Dr. Lisa Mosconi titled Menopause Brain, she also states that perimenopause changes the brain in profound ways. Menopause Brain will be released very shortly, and I highly recommend reading it when it does. And I'm also hoping to get Dr. Mosconi on the podcast in the coming months after the book is released. Now, without further ado, here are the symptoms that can be experienced during perimenopause due to declining and fluctuating hormones, namely progesterone, estradiol, and testosterone. And note that these changes can also have a great impact on cortisol, melatonin, thyroid, insulin, leptin, DHEA, and many other hormones. Now, I will read them off slowly so that you can tune into the ones that feel most true for you. So let's start with mental health symptoms, because this can feel like the most disruptive for some women. Honestly, it's felt like the most disruptive for me. And I'm gonna ask these in a question so that you can kind of, I like when an assessment asks a question, because then my brain wants to answer it. So here we go. Are you forgetting things more than normal or experiencing brain fog where you are mentally drained or unable to concentrate? Are you having memory issues? Are you experiencing mood swings? Do you often feel irritable or even rageful disproportionately? Do you feel anxious or depressed, or both? Do you have a lack of confidence in yourself and have lost interest in things that used to excite you? Physical symptoms. Are you experiencing hot flashes, meaning like temperature surges, accompanied by heat and sweat, especially in the face, neck, and chest? Do you feel bloated? Are you gaining weight for no obvious reason? Has your body composition shifted and you've noticed stubborn weight on your hips, thighs, or belly? Do you have poor metabolic health? Do your breasts feel tender, hard, and lumpy? Do you have a burning sensation on your tongue and in your mouth? Are your ears itchy? Are your eyes dry? Is your skin dry? Are your skin and hair just like thinning, right? Are your nails brittle? Are you getting urinary tract infections? Do you have incontinence? Have you experienced tinnitus or unexplained ringing, roaring, or buzzing sounds in your ears? Have you been diagnosed with early fatty liver disease? Are you experiencing any gastrointestinal issues? Do you have joint pain? Do you feel dizzy when you stand up suddenly? Are you having heart palpitations? Are you experiencing muscle aches or pains? Do you have sarcopenia or age-related involuntary loss of skeletal muscle mass and strength? So have you noticed a loss in strength? Have you been diagnosed with osteoporosis? Menstrual cycle symptoms. Are your periods heavier than normal? This means you change a tampon or pad within 2 hours or pass a clot the size of a quarter or larger. Do your PMS symptoms seem more intense? Has the length or duration of your cycle changed? Have you skipped any months of your cycle? Have you been diagnosed with a sleep disorder like insomnia or sleep apnea? Are you waking up drenched in sweat in the middle of the night? Do you feel fatigued even after a full night's sleep? And then, is your libido lower than normal or has it disappeared altogether? Has intercourse become painful? Are you experiencing vaginal dryness? And are you experiencing leakage? Those were the 40 symptoms list for perimenopause. And mind you, this is not the most extensive list. It's pretty extensive. And if you need to go back and listen again, by all means, go and do so. I know how important it is to know if you are indeed perimenopause because your body is changing. So the sooner that we can identify that we're in that transition, the better we can set ourselves up for success. Now, as I mentioned earlier, the majority of women will experience at least some symptoms during perimenopause, which can affect both our home and our work lives. The symptoms you may hear about often are hot flashes and night sweats. And this is so misleading because women can experience symptoms all over the body and every organ system due to declining hormone levels. Every organ system is affected by the decline of our hormones during this transition, right? I talked about the brain, the cardiovascular system, bones, metabolic health, inflammation, muscles and joints, hair and skin, even the gut. And lower levels of progesterone and estradiol really speed up the aging process. Lower estrogen results in less muscle mass, shifts fat from butt and hips to the belly, drives insulin resistance, and slows down your metabolism. Lower progesterone leads to more deregulated stress, and lower testosterone also disrupts your metabolic balance and lowers your muscle mass if it starts to lower. In short, these declining hormone levels really are not setting us up for success. So what do we do if the default normal hormonal menopause process paired with our modern day lifestyle is not necessarily moving us in the direction of longevity and resilience, right? Even though we are living longer, 25% of our lives, women, are spent dealing with chronic conditions. So what do we do if our bodies are changing without permission? Well, we pivot the best we can. We get clear on our why and our vision. We adopt a metabolically healthy meal plan. We prioritize protein for muscle protein synthesis. We increase insulin sensitivity by optimizing our blood sugar. We supplement with bioidentical hormone replacement. We replace nutrient deficiencies. We move our body throughout the day. We fiercely protect our sleep. We get outside in nature. We resistance train to maintain and build muscle. I'm talking about lifting heavy weights. We drink clean water with electrolytes. We hang out with our besties in real time. We practice self-care. We reduce or remove alcohol. We get sunlight in the morning. We get our labs tested and we make modifications from those results. And obviously this is an abbreviated list and I plan to dive deeper in my live class coming up on March 12th. I also cover all of this in my midlife metabolism and hormone reset course because we deserve this information and a strategy to make these changes. Now, I also want you to know that I am releasing another solo episode this Friday, March 8th, on the science behind menopausal weight gain and body composition changes. Please tune in if you want a deeper dive into the science of menopausal weight gain because it's real. And it's time that we understand the changes that happen to our bodies due to perimenopause and menopause. I'm so tired of women being told that they're lazy or they're just not eating right or they're not exercising the right way. It is menopause that is driving weight changes and body composition changes. That's the deal. So many women are like, I have not changed anything and yet put on 5 pounds, 10 pounds. There's a reason for this and you deserve to know. If you have a friend who thinks that she might be in perimenopause and she's going down all the rabbit holes, please share this episode. And if this topic was helpful for you today, I know that I was a little bit all over the place. I mean, this was very much an organized episode, but I'll tell you what, I am 3 days out from my period and my hormones chose violent 2 days ago. My brain is on the fritz today and I'm just taking it one day at a time and doing all the things that I just mentioned to you right up there, that I just mentioned to you a minute ago, to do my best to navigate these changes. I think one of the biggest hits that I have felt that have been so true for me, especially after the brain injury, is that my brain is just, some days it's just on the fritz, especially when I'm dealing with migraines. And so some days when I'm recording or writing, it just takes a little bit extra effort. So again, as much as this episode may have deviated a little bit, if it was helpful, please share it and then take a moment and quickly rate the show. The show right now has 910 reviews right now. And my goal is to get to 1,000 this year in 2024. And I know we can do it. I know I can do it with your help. And what that opens up for is that more women are getting this information. They're getting educated. They are walking away empowered. That is my intention. Because this time, midlife, it is something else. And the more support and guidance and science that we can have to back up and validate what we're experiencing is just going to set us up for success. So until the next episode, which is happening on Friday, I hope you're having a beautiful day.